Hi guys, welcome back to this recall session of FMG July 2025 surgery. So guys, I hope you did well in the exam. Let's straightforward start the discussion. Can you tell me which of the following structure causes this defect? So can you see this defect here? Yes, so you can see this defect here. What is the problem here? You can notice that this patient is having dimpling. So can you tell me dimpling is because of involvement of which ligament or which structure? So you know that this is dimpling and it is because of involvement of Cooper's ligament. So dimpling, it is because of involvement of Cooper's ligament. Suppose the patient is having pudgy orange. You know pudgy orange, it is because of involvement of what? Subdermal lymphatics. So if there is involvement of subdermal lymphatics, there is lymphatic permeation by tumor cells. After that, what will happen? There is cutaneous edema. So that leads to pudgy orange here. Dimpling and puckering, both of these are because of involvement of which ligament? Cooper's ligament. So you know that dimpling and puckering, these are because of involvement of Cooper's ligament. What is dimpling? Dimpling kya hota hai? It is skin depression. What is puckering? Wrinkling in the breast skin, that is puckering. Clear? So wrinkling in the breast skin, that is puckering. Okay. So wrinkling in the breast skin, that is puckering. Clear, guys? So what is the correct answer for this question? The correct answer for this question is option A, Cooper's ligament. It is the Cooper's ligament. Cooper's ligament. Clear? Next question. Anybody wants to add something in this question? Anybody wants to add something in this question? Yes? So guys, anybody wants to add in something in this question? Yes, Vinay, Tushar, Dr. Nadeem. Same question tha, Tushar Bhargav. Okay, so the same question was there. So it is because of Cooper's ligament, right? Second question, देखिए, identify the modality. Guys, can you tell me what is the correct answer? Brinda, Tushar, Nadeem, can you tell me what is the correct answer here? You can see the image and tell me what is the correct answer. Yes, everybody is correct. This is mammography. Here you can notice that you can notice this. Yes, microcalcifications, and here you can see the opacity. So this is mammography. This is what? This is mammography. It is mammography. So correct answer is option A. This is mammography, right? What is the next question? You can see the next question. Easy question. So it's an integrated question of medicine, pathology, surgery, right? Vinay, Saurav, Aryan Singh, Dr. Nadeem. Can you tell me what is the correct answer? Patient presents with, you can see here, guys, patient presents with weight gain, thinning of hair. So there is thinning of hair, dry skin. Clinical features are suggestive of Hashimoto's thyroiditis. So it's one of the easiest question. Which of the following antibodies is most commonly associated with this condition? One of the easiest. So you know that autoantibody, everybody is correct. Shireen, Islamic, Chahat, Sunil, Nadeem, yes, everybody is correct. This is anti-TPO. And guys, you know what is the full form of anti-TPO? Anti-thyroid peroxidase. So what is the correct answer, guys? It is anti-TPO, anti-thyroid peroxidase. And you know that in Graves' disease, what is the autoantibody? The autoantibody in Graves' disease, that is LATS. LATS, long-acting thyroid stimulator against TSH receptor. So this is against TSH receptor. So this is for Graves here. यहाँ पे correct answer क्या होगा? Here the correct answer will be anti-thyroid peroxidase. Anti-thyroid peroxidase antibody. Okay. Vinay, very good. Next question देखिए. Mutation in which of the following genes is most commonly associated with medullary thyroid carcinoma? Easiest question. बताइए what is the correct answer? Yes, guys, it's easiest. Mutation in which of the following genes is most commonly associated with medullary thyroid cancer? Yes, so you know that what? It is red protoncogene mutation. So it is red. This is red protoncogene mutation. So this is red protoncogene mutation. Protoncogene mutation. Can anybody tell me that this red protoncogene mutation, it is associated with MEN syndrome? कौन से MEN syndrome के साथ associated है बताइए? Multiple endocrine neoplasia. Which MEN? Which MEN? Okay, Dr. Nadeem wants to say that, sir, actually it was asked about calcitonin. It is associated with मेन 2A 2B, जिसको हम मेन 2 बोलते हैं, और मेन 2B को हम बोलते हैं मेन 3. मेन 2B, मेन 2A 2B दोनों के लिए दिस रेड प्रोटॉन को जीन म्यूटेशन इज रिस्पॉन्सिबल. ओके, क्लियर, राइट. सो समबडी इज सेइंग दैट उसमें कैल्सिटोनिन था, कैल्सिटोनिन रिलेटेड. सो यू कैन सी कि अगर इनडायरेक्ट क्वेश्चन हो सकता है, बिकॉज यू नो दैट कैल्सिटोनिन इज रेज्ड. व्हाट? कैल्सिटोनिन. सो कैल्सिटोनिन इज रेज्ड. So calcitonin, it is raised in medullary carcinoma thyroid. Clear? And here the mutation will be ret. Main 2 भी था वहां पे. Okay. So if even if main 2 is also there, so this is associated with ret protoncogene mutation. So what is the correct answer here? यहाँ थोड़ा सा ऐसा लग रहा है कि there was a integrated question. थोड़ा सा language में calcitonin main 2 भी mentioned था. So here the correct answer would be what? Option C, ret. After that, can you see this question? Which drug is used in the preoperative management of pheochromocytoma? It is easiest question. So first, what you have to control? First, you have to control, yes, blood pressure. For blood pressure control, guys, tell me first we give alpha blockers or beta blockers. So everybody know that first we give alpha blockers. And what is the drug of choice? It is non-selective alpha blocker, and that is phenoxybenzamine. So it is non-selective alpha blocker. It is phenoxybenzamine. That is phenoxybenzamine. So what is the correct answer? Correct answer is pheochromocytoma. It is pheochromocytoma. One more question. Somebody was telling me कि sir pheochromocytoma से related एक और question था. There was one more question related to pheochromocytoma. There was one more question related to pheochromocytoma. Anybody remembers that? Okay. So if anybody remembers that, please message the question, language of the question. Next question, you can see here. 46 years old male had a tumor in left lobe of liver. So you can see here, this is the liver. In the left lobe, there is tumor. So left-sided hemihepatectomy was planned. It was hemihepatectomy. Which of the following lobes of liver will be resected in this procedure? So it's easy question, guys. Tell me. Easiest question. पूजा इन्वेस्टिगेशन में यूरिनरी था. यस, वीएम में. ओके, मेटानेफ्रिन्स था क्वेश्चन में. ठीक है. So that was related to pheochromocytoma. Here, you know that the segmental distribution. Here you can notice that this is IVC. This is the gallbladder fossa. So this is middle thyroid. This is middle. You can see here, there is main portal fissure. This is left portal fissure. This is right portal fissure. You can see the segments. This is segment 2. This is segment 3. You have 4A. This is 4B. You can see here. This is segment 5. This is segment 6. This is 7. And this is 8. So guys, all of you know, हम लोग इसमें क्या निकाल रहे हैं? We are removing this left lobe. And if you are removing the left lobe, you are removing what? Segment 2, 3, 4. So we are removing segment 2, 3, 4. So it is segment 2, 3, 4. So you can see here, we are removing segment 2, 3, 4. Correct answer क्या होगा? Correct answer is A. Vamsi, Aryan Singh Medicine, Sunil, almost everybody is correct. So it is 2, 3, 4. 4 का मतलब है 4A, 4B. So here what is the correct answer? Correct answer is 2, 3, 4. Next question. Which of the following is a recommended treatment for esophageal varices? आप सबको पता है what is the treatment option for esophageal varices, how we control the bleeding. हमारे पास दो option है. We have endoscopic varicose ligation and the second option is sclerotherapy. Endoscopic sclerotherapy. Can you tell me which one is preferred? बताइए. Which one is the treatment of choice? Shruti, Yugal, Diluminati, Tushar, Sharon, Rudra, almost everybody is correct. Everybody is correct, guys. It is endoscopic varicose ligation. So what is the correct answer? Endoscopic varicose ligation. Correct answer क्या होगा? Option A. So this is endoscopic varicose ligation. Clear? That is the correct answer. Endoscopic varicose ligation. Next question, guys. Easiest question. 30 years old female presented with pain in right upper quadrant of abdomen. After 4 days of cholecystectomy, on ultrasound, there is significant collection in the right upper quadrant. What will you do further? Tell me. On ultrasound, there is significant collection. Let me tell you a question कई बार आ चुका है. It was asked in FMG also, NEET PG also, INICET also. Yes, very good. Sunil, Denchik, Diluminati, Shubham, Nadeem. Okay, it was 300 ml of fluid. How much fluid was there? It was 300 ml of fluid was there. Okay, guys, let me tell you what is the protocol. देखिए, there are two situations. One, whenever you are performing lap cholecystectomy, if some bile duct injury is there, you detected injury intraoperatively, you can perform the repair. Second situation, you discharge the patient, and in the post-operative period, you are going to diagnose that patient is having bile duct injury because patient will be complaining of pain and tenderness in right upper quadrant. So what is the first step? First, control the infection. The first step is control the infection. After that, second, since there is collection of bile, this is known as drain the biloma. What? Drain the biloma. How to drain the biloma? You perform ultrasound. If there is collection, so we go for ultrasound or CT guided percutaneous aspiration. If huge collection is there, we insert a pigtail catheter. Third, complete the cholangiography. How you do the cholangiography? We go for MRCP. And fourth, definitive intervention. Definitive intervention means, what do you mean by definitive intervention? Whenever injury is going to occur, what will happen? Yes, there is formation of stricture. And for stricture, either you can insert the stent or you can go for hepaticojejunostomy. Since here there is significant amount of collection in right upper quadrant, what should be done, guys? Almost everybody is correct. It is ultrasound guided aspiration of content. So this is ultrasound guided aspiration of content. Cinema sickness. Next, immediate management with option analgesic and IV antibiotic. No, first option क्या होगा? First option is start IV antibiotic. Send the patient for ultrasound. On ultrasound, if the fluid collection is there, aspirate it or insert the drain. उसके बाद third, go for MRCP. Fourth, definitive intervention. ठीक है? Okay. Why not to do MRCP first and find out the leak? Why you want to find the leak? Because already you can see the leak. MRCP takes time. Okay? And on ultrasound, if you can see the fluid, already there is a leak. You got it? So third step is MRCP. And why we do MRCP? MRCP is not very sensitive for the leak. क्योंकि वहां आपको leak है, so you are not going to detect the exact site. You know that there is leak. We are not treating it. We are just draining it. So drain the biloma. After that, after 4 to 6 weeks, there will be stricture. And for diagnosis of stricture, हम लोग क्या करते हैं? फिर हम करते हैं MRCP, and then we go for definitive intervention. Yugal, am I clear? Yes, Yugal, waiting for your reply, guy. Clear? So MRCP is not done immediately. Okay? Next. A follow-up patient of GERD on endoscopy was having nodule in second part of duodenum. Which hormone you are suspecting to be raised? Guys, tell me first. What is the cause of GERD here? Anybody? Easiest question. Easiest. Now see, it's very easy. What is the problem here? This patient is having a nodule in second part of duodenum, right? So what is the problem? Patient is having gastrinoma. And because of gastrinoma, there is increased secretion of acid. And because of this increased secretion of acid, what? Patient is having symptoms of reflux. Got it? So it is gastrinoma. और आप सबको पता है, what is the other name of gastrinoma, guys? It is Zollinger-Ellison syndrome. It is Zollinger-Ellison syndrome. And you know that what is the most common site of gastrinoma or Zollinger-Ellison syndrome? Tell me. It is pancreas. Guys, tell me. It is pancreas or it is duodenum? It is pancreas or duodenum. So guys, it is pancreas or duodenum. It is duodenum followed by pancreas. So the most common site is duodenum followed by pancreas. So one question for all of you. One question for all of you. What is the most common site of gastrinoma in duodenum? Duodenum में most common site क्या है बताइए? First part, second part, third part, fourth part. Tell me guys, it is first part, second part, third part, fourth part. Yes, let me see who's the genius over here. Let me see who's the genius over here. Guys, it is first part. It is first part. It is first part. Clear? So that's first part. So that is first part. So it is the first part of duodenum, followed by second part, followed by third part, It is not seen in fourth part. So this is Zollinger-Ellison syndrome. यहाँ correct answer क्या होगा? Correct answer will be gastrinoma. Suppose patient is having insulinoma. Can you tell me what is the most common site? It is equally distributed in head, body, and tail. Suppose it is VI poma. What is the most common site? It is tail. And suppose it is glucagonoma. Can anybody tell me what is the most common site of glucagonoma? Brinda, Prakhar, Sunil, Rudra, Tushar, Shubham. Tell me. Glucagonoma. Guys, glucagonoma. What is the most common site? Glucagonoma. Glucagonoma. Yes, it's easy question. Very no, no, no. It's not head and tail. Prakhar, it is body and tail. Nadeem, very good, Nadeem. It is body and tail. So glucagonoma, that is body and tail. Body and tail, and all of you know that. Insulinoma, it is equally distributed in head, body, and tail. Head, body, and tail. Clear? So correct answer is A, gastrin. Next question, guys. Easiest, all of you know the answer. In Barrett's esophagus, there is columnar metaplasia. So there is epithelial transformation. Can you tell me what is the correct answer here? Denchik wants to say that कि sir first part दिया था question में. Denchik wants to say that sir first part of duodenum was given in the question. Guys, I'm asking this question. First part दिया था या second part? Which part was given? First part or second part? Okay, here everybody is correct. It is columnar metaplasia. So it is squamous to intestinal columnar epithelium. So there is columnar metaplasia. So it is squamous. It is squamous to columnar. It is squamous to columnar epithelium. So what is the correct answer? What is the correct answer? The correct answer is option B. It is option B. Okay. Next question, guys. 30 years old man came with choking episodes after ingestion of fish bone while eating. The fish bone got impacted at the level of T4 in the esophagus. Which is the most likely site of obstruction? Easiest question, guys, tell me. Easiest question, tell me what is the correct answer here. Easiest, tell me what is the correct answer. Yes, very good. So almost everybody is correct. Okay, now see here. T4 was in answer option. Okay. Denchik wants to say that T4 was in answer option. Guys, see, both of these are correct. Left bronchus and arch of aorta दोनों सही है because the level is both arch of aorta and left bronchus. दोनों होता है. But actually, अगर इन दोनों में से choose करना है, then you should choose arch of aorta. You know that. What are the constrictions in the esophagus? If you perform endoscopy, you're going to find 3 constrictions from upper incisor. कितने सेंटीमीटर पे? At 15, at 25, at 40. And how to remember? The mnemonic is bald. It is bald. So B is beginning. Beginning of esophagus, guys, you know, it is cricopharynx. So beginning of esophagus, that is cricopharynx. A का मतलब है arch of aorta. L का मतलब है left bronchus. D का मतलब है opening in diaphragm. So this is opening in diaphragm. So what is the correct answer here? The correct answer here. Okay. Okay. Drishti Patel wants to say that कि सच सही है. Clear? So it is arch of aorta. Guys, if you have to mark one, go for arch of aorta. So correct answer is B. Next, what is the most appropriate treatment for chylomlymphatic mesenteric cyst? It is chylomlymphatic mesenteric cyst. Most appropriate treatment. Guys, tell me, क्या करेंगे इसमें? We go for aspiration, nucleation, resection of cyst along with adjacent bowel. Okay, how many types of mesenteric cysts are there? Chylomlymphatic, enterogenous, simple और mesothelial, dermoid, arising from urogenital remnant. ठीक है, most common क्या होता है? The most common is chylomlymphatic. What do you mean by chylomlymphatic? Chylo means chylous component. So there is chyle. Lymphatic means arising from lymphatics. Now see here, this is the bowel. This is the mesentery. You can see, guys, this is the bowel. This is the mesentery, and this is the chylomlymphatic cyst. It is having its independent vascular supply, no shared wall, no shared vascular supply. If there is no shared wall, no shared vascular supply, in that case, go for enucleation. और जो एंटेरोजीनस होता है, एंटेरोजीनस, एंटेरो मतलब स्मॉल बावेल, जीनस मीन्स ओरिजिन. So whenever it is arising from the bowel, one wall is shared. And if one wall is shared, in that case, you have to go for resection and anastomosis. So resection and anastomosis is done in enterogenous cyst. It is done in enterogenous cyst. It is done in enterogenous cyst. And in chylolymphatic cyst, what is the treatment of choice, guys? Enucleation. So enucleation. Drashti Patel wants to say that, sir, size bhi diya tha 8 centimeter. 8 centimeter size was given. Very good. So the size of cyst was size of 8 centimeter. Okay. Bunny wants to say that question was different in the exam. मेजॉरिटी ऑफ स्टूडेंट्स ने जो मेंशन किया है, उन्होंने ये बताया कि सर मेजेंट्रिक सिस्ट था, काइलोलिम्फेटिक था और ट्रीटमेंट पूछा था. देयर माइट बी वेरिएशन इन द लैंग्वेज ऑफ द क्वेश्चन. गॉट इट? बट व्हाट इज द करेक्ट आंसर, गाइस? इन्यूक्लिएशन. तो एंटेरोजीनस के लिए हम करते हैं रिसेक्शन एंड एनास्टोमोसिस. एंड इफ पेशेंट इज हैविंग काइलोलिम्फेटिक सिस्ट, करेक्ट आंसर इज गो फॉर इन्यूक्लिएशन. सो गो फॉर इन्यूक्लिएशन. नेक्स्ट क्वेश्चन, इजीएस्ट क्वेश्चन. बताइए जरा इसका आंसर क्या होगा. गाइस टेल मी द आंसर. 16 years old boy presents with multiple episodes of abdominal pain and history of passing blood in stool. On examination, dark pigmented spots on the lips and oral mucosa. Endoscopy पे multiple hematomatous polyp in small intestine. Most likely diagnosis. Guys, yes, Dr. Bhushan, actually ये most important question भी है, favorite question भी है. Can anybody tell me what is the cause of abdominal pain? Guys, tell me. Anybody tell me what is the cause of abdominal pain? Dhirendra, Mia, Miara Khan, Dr. Sunil, Ajit. What is the cause? Okay, why there is pain? Now see, the patient is having multiple polyps in the small intestine, mainly jejunum. And because of those polyps, patient is having intussusception. So what is the problem, guys? These patients are having recurrent intussusception. So there is recurrent intussusception. Because of that, patient is having recurrent abdominal pain. जिसकी वजह से bleeding भी होती है, right? There is pigmented, hyperpigmented macules, and what else? Hematomatous polyps. So this is Peutz-Jeghers syndrome. And all of you know, what is the name of gene mutated? Guys, you must be knowing the name of gene mutated. Yes, Bunny, you are correct. Yugal. So it is LKB1STK11. So the name of gene, it is LKB1STK11 located on chromosome number 19. Peutz-Jeghers almost हर साल आता है, हर एग्जाम में, कभी कभी INICET, NEET PG और FMG exam. So LKB1STK11 located on chromosome number 19. Correct answer is B. Next question, guys. Again, easy. HNPCC, hereditary non-polyposis colon cancer. Lynch syndrome is caused by mutation of which gene? Dhirendra, very good, Dhirendra. Tell me, guys, here. HNPCC. HNPCC, yes. So it is because of mismatch repair gene abnormality, MMR. It is because of mismatch repair gene abnormality. So it is HNPCC because of mismatch repair gene abnormality. How many genes are responsible? Total 7 genes are responsible, located on chromosome number 237. And for 90% cases, 2 genes are responsible, HMLH1. So the genes are HMLH1 and HMSH2. So it is HMLH1, HMSH2. These are responsible for 90% cases. 90% cases, all of you know that this is autosomal dominant. Okay, autosomal dominant. Clear? So it is autosomal dominant. Autosomal dominant. Clear? So it is autosomal dominant. Right? So correct answer is B. Okay, next. A neonate has intestines protruding from abdomen without any external covering. What will be your next line of management? First tell me, what's the diagnosis here? Easiest question. ये FMG NEET PG का फेमस क्वेश्चन है, हर साल आता है. ईदर ओम्फैलोसील और गैस्ट्रोस्कीसिस. ओम्फैलोसील और थैंक यू बनी, थैंक यू. यस, ओके, धीरेन्द्र वांट्स टू से सर सेकंड एग्जाम में जितने क्वेश्चन मेरे 100% कॉन्फिडेंस के थे सब में ऑप्शन सी था। अच्छा, सो गाइज एवरीबडी इज करेक्ट, इट इज गैस्ट्रोस्कीसिस बिकॉज द बावेल इज नॉट कवर्ड। एंड वी डिस्कस्ड, अगर आप लोगों ने क्लास देखा होगा, हम लोगों ने डिस्कस किया था, क्योंकि ये लास्ट टाइम लास्ट टू लास्ट एग्जाम में देयर वाज वन क्वेश्चन रिलेटेड टू गैस्ट्रोस्कीसिस मैनेजमेंट। सो वी डिस्कस दैट व्हाट वी डू, वी कवर द बावेल, हाउ you cover it in a silo bag, and we have to wait and watch so that slowly it get reduced. And when it get reduced, if it's huge, after that we go for primary closure. So surgical correction immediately is not done. Conservative management with higher antibiotic, no. First you have to cover it. Clear? You know, silo. Suppose this is the patient. Suppose this is the patient. Here, this is the bowel which is protruded. Here you have to apply a silo, so it is covered with gravity. Slowly the part of bowel is reduced in the abdomen, and when significant part of bowel is reduced in abdomen because there is growth of abdominal wall, after that we go for closure. So this is application of silo bag and then closure. So correct answer is option C. ये question में कितने लोगों का सही हुआ? Tell me guys. How many of you mark this question correctly? और मैं फिर से बता रहा हूं, अगेन इन द अपकमिंग एग्जाम दिस क्वेश्चन विल बी आस्क्ड, और मैं आपको प्रिडिक्ट करके बता रहा हूं, इवन इन नीट पीजी विच इज on the 3rd of August, there will be one question related to gastroschisis and omphalocele. Okay, very good. Ketan, Aryan, almost everybody. So that's great, guys. Great. Correct answer is C. इसके बाद easiest question, so many clues are there in this question, so many clues are there. A 25 years old man presents with headache, visual disturbances and hypertension. MRI brain shows cerebellar hemangioblastoma. सबसे पहले बताइए, what is the cause of headache, visual disturbances, hypertension? Guys, tell me. Abdominal imaging revealed multiple cysts in the kidney, along with solid renal mass, suggestive of RCC. So there is pheochromocytoma. Can you see, guys? Hypertension, headache, visual disturbances. There is brain tumor, hemangioblastoma. There is RCC. There is renal cyst. Family history of brain tumor. So all of you know what is the name of this syndrome. So von Hippel-Lindau. This is VHL syndrome. So von Hippel-Lindau, that is VHL syndrome. And you know that it is caused by deletion of chromosome number 3p. Short arm पे होता है. So it is because of chromosome number 3p. So deletion of chromosome number 3p. Correct answer क्या होगा? Option C, deletion of chromosome number 3p. Clear guys? So it is because of deletion of chromosome number 3p. Correct answer is option C. It is option C. Okay, somebody wants to ask कि सब directly question पूछा था कि क्या होगा? Mutation नहीं पूछा था. It was asked that what is the diagnosis? VHL syndrome. Okay, so option was not having chromosomes. Option में diagnosis पूछा था. So what is the diagnosis? So diagnosis is VHL syndrome. VHL syndrome. Clear? So VHL syndrome. That's the diagnosis. Clear? VHL was answered. Very good. Then check. So VHL syndrome. Next question, guys. Identify the procedure. What you can see here, you can notice that you can see the kidney. Clear? And you can see the dye going into the ureter. Kidney has taken the dye, it is going into ureter, and it is entering into the bladder. Guys, all of you know what is this? This is IVP. So what is the name of this procedure? This is intravenous pyelogram, also known as IVU. Intravenous pyelogram or intravenous urogram. So everybody is correct. Correct answer is option A. Next. Tell me what is the correct answer here. Very easy question. 13 years old male was brought to OPD with pain on the right side of testis. After being hit by a cricket ball 2 hours back on examination, severe testicular pain and absent cremastic reflex. What is the next step? देवेंद्र पटेल wants to ask, sir, इसके क्वेश्चन नीट में आ सकते हैं? देखिए, there is overlap of questions between NEET and FMG. You know that there is no difference between the level of FMG and NEET. Conducting body is same. तो इसका उसमें, उसका इसमें, ये लोग करते हैं. Topics might be asked, some questions might be asked. जैसे आपने देखा था लैब पुली वाला क्वेश्चन, it was asked in INICET, NEET PG, FMG. ये गैस्ट्रोस्कीसिस वाला ये भी आ चुका है, प्यूर जेगर सिंड्रोम ये भी. So these topics are evergreen topics, right? Of surgery. सारे एग्जाम में आते हैं. So it will be helpful for that also. So we go for Doppler. अब बताइए which one? Tell me the option. Bunny, Which one? Surgical exploration, venous Doppler, NSAIDs, arterial Doppler. Yes, guys, let me tell you what you suspect. देखिए, there is severe testicular pain, absent cremastic reflex. Whenever there is testicular torsion, this cremastic reflex is absent. Cremastic reflex is absent. Got it? So you suspect testicular torsion. And whenever you are suspecting testicular torsion, what is the investigation of choice? Testicular torsion. हमें ये देखना है उसकी blood supply. So we are supposed to see the arterial supply. So obviously it is arterial Doppler. What is the correct answer? It is Doppler. So it is ultrasound arterial Doppler. Only one option was there in the Doppler. So अगर सिर्फ एक ही option है, obviously, so it's Doppler. It's Doppler. Only one option was there with Doppler, so it's Doppler, right? So confirm it, and then you have to perform the exploration. पहले था within 4 hours surgical exploration should be done. अभी है within 6 hours. It should be done within 6 hours. So surgical exploration should be done within 6 hours. So surgical exploration should be done within 6 hours. Clear? So correct answer is option A, Doppler. Okay, one option was give IV antibiotics and referral and refer. IV antibiotics and refer. So guys, first we confirm the diagnosis by Doppler. एक बार Doppler पे diagnosis बन जाए, उसके बाद we have to go for surgical exploration. So what should be done? Surgical exploration. Bunny wants to say that 6 hours ही था, 6 hours. Okay. So what happens? Definitive treatment. See guys, two things are there. अगर सिर्फ next step पूछेगा, what is the next step? It is Doppler. What is the definitive treatment? Definitive treatment is surgical exploration. What is the definitive treatment? Definitive treatment is surgical exploration. Next step, you have to, okay, they mentioned 6 hours. Okay, being hit cricket ball, 6 hours, right? So within 6 hours, you have to go for surgical exploration. But before that, you have to confirm the diagnosis. तो हम क्या करेंगे? First, go for, what is the next step? Go for confirmation of diagnosis. So we go for Doppler first, and after Doppler we have to go for surgical exploration. और surgical exploration में क्या करेंगे? We perform detorsion, and after that we perform orchidopexy. Got it? So depending upon the language of question, you have to mark the correct answer. Okay. Next, 2 months old male. ये question tricky है. Let me see who is going to reply this question correctly. 2 months old male infant presents with scrotal swelling. There is scrotal swelling. Okay. Has been present since birth. Now the swelling has become suddenly painful, red and irreducible. Now what is the catch point here guys? The catch point यहाँ क्या है? Irreducible. मतलब कोई ऐसी swelling जो पहले reducible थी, अभी irreducible हो गई है. इसका मतलब what's the diagnosis? Easiest question guys, what is the diagnosis? कोई ऐसी swelling जो पहले reducible थी, now it has become irreducible. Yes? ओके, शिवानी वांट्स टू से सर 2 years, 2 साल का बच्चा था. ओके, फिर तो प्रॉब्लम ही सॉल्व हो गया. 2 years. नाउ सी गाइस, अगर कोई चीज रिड्यूसिबल थी अभी इरिड्यूसिबल हो गई, इट्स हर्निया. एंड व्हाट काइंड ऑफ हर्निया? यस, एक्चुअली पेशेंट इज हैविंग कंजेनाइटल हाइड्रोसील, एंड एक्चुअली कंजेनाइटल हाइड्रोसील में देयर इज पेटेंट प्रोसेसस वेजिनालिस. और अगर ये इरिड्यूसिबल हो गई, इसका मतलब नाउ इट इज कन्वर्टेड इनटू हर्निया, क्योंकि उसमें क्या आ गया है? उसमें बावेल आ गया है. We have to wait for 2 years. Whenever patient is having congenital hydrocele, wait for 2 years. And after that, what you have to do? You have to go for herniatomy. So this is not acute epididymoarthritis. Acute epididymoarthritis में irreducibility criteria नहीं होती. Torsion में भी irreducibility का criteria नहीं होता. Incarcerated or strangulated inguinal hernia. Incarceration में क्या होता है? In incarceration, it is irreducible, but it is not suddenly painful. When it's painful, iska matlab there is vascular supply which is impaired. So what you have to mark? You have to mark strangulated inguinal hernia. Okay. Ved Prakash wants to say that 2 centimeter swelling tha sir. Swelling with fluctuation. Okay. So there was swelling with fluctuation. ठीक है. This finding is also suggestive of congenital hydrocele. और अगर ये painful है, red है, irreducible है. Okay. So red fluctuation was also there. So even if fluctuation is there, It is painful. Yes. Fluctuation. Guys, epididymoarthritis में fluctuation नहीं होता. Testicular torsion में fluctuation नहीं होता. So what is the correct answer? It is strangulated inguinal hernia. Sudden painful. Yes. So there is C. It is sudden, right? So all these findings are suggestive of what? Strangulation. Strangulation. So correct answer is option C. Correct answer is option C. Clear? Next, a patient underwent split thickness skin grafting for a burn injury on the arm. On post-operative day 6, develops stiffness of the arm during physiotherapy. What is the most appropriate next step in management? Suppose आप में से अगर किसी को फ्रैक्चर हुआ हो और प्लास्टर लगा हो, after that what happens? Yes, there is stiffness. So if there is stiffness, tell me what is the advice given? Yes, guys, what is the advice given? So whenever you go for grafting, after burns, if there is some kind of stiffness, immediately you are not going to excise this. Clear? What you have to do, you have to continue the physiotherapy. You have to continue the physiotherapy without any intervention immediately, right? So surgical excision of contracture, it is not done on day 6. Passive extension of joint under direct visualization of graft, no. What you have to do, continue the physiotherapy without intervention. And in majority of cases, what? Patients are going to improve. Remove the graft and regraft the area? No, we are not going to remove the graft. So what we have to do, guys, continue the physiotherapy without any intervention. Yes, very good. So we continue physiotherapy after waiting for 2 to 3 days. Maulin, Raj, Dodia, you are correct. Guys, so here what? Continue the physiotherapy क्योंकि 6 days पे contracture नहीं बनेगा. Right? When patient develops contracture later, we have other options. We can go for Z-plasty, we can go for excision. So here, correct answer is option C. Let me tell you, this question was a new question. It was asked for the first time. First time ऐसा क्वेश्चन पूछा था related to burns. Contracture का क्वेश्चन कई बार आ चुका था, but this was asked for the first time. So continue physiotherapy without intervention. Next question, guys, you can see here over the anteromedial aspect of leg, you can see the varicosity. So you can see which vein is involved here. Tell me. Okay, wait, Prakash. 2 to 3 days, wait for physiotherapist. Yes. So wait for 2 to 3 days. ठीक है. Wait for 2 to 3 days. Yes, so this is better. This option is better and this is the correct one. Here, guys, which vein is involved here? So you know that this is long saphenous vein or great saphenous vein. Great saphenous vein or long saphenous vein, it is located over the anteromedial aspect. So this is located over the anteromedial aspect. Anteromedial aspect. And small saphenous vein or short saphenous vein, it is located over posterolateral aspect. So this is located over posterolateral. Located over posterolateral aspect. So located over posterolateral aspect, great saphenous vein, anteromedial aspect. Clear? Correct answer is option A. Next, identify the type of suture. आप सबने suturing किया होगा, बताइए जरा. Yes, आपने यहाँ लगा दिया, उसके बाद interrupt कर दिया, फिर लगाया, interrupt कर दिया, लगाया, interrupt कर दिया. Easiest question? Yes, this is simple interrupted suture. So this is simple interrupted suture. Mattress suture में क्या होता है? See, this is the mattress. Mattress में ये आपका incision है. It's like this. Clear? So here, this is simple interrupted. Then your needle moves horizontally. और vertical mattress में क्या होता है? It's like this. It's like this. The needle moves vertically, and then you perform the suturing. So this is vertical mattress. Subcuticular में क्या होता है? It is beneath the skin. Guys, so how to identify? Suppose this is the line of incision, and if your suture is parallel to line of incision, this is horizontal mattress. And suppose this is the line of incision, and if your suture is perpendicular, if your suture is perpendicular to the line of incision, this is vertical. So this is vertical mattress. This one is horizontal mattress. Horizontal mattress. Clear? In subcuticular suturing, what happens? Suppose this is the skin. So what happens? The suture is beneath the skin. So it is subcuticular suturing. Somebody says, Ved Prakash. Vertical की इमेज थी. अच्छा, वेद प्रकाश तो अगर वर्टिकल की इमेज थी गाइस, वर्टिकल में देखिए कैसा पिक्चर होगा। आई एम रिपीटिंग इट अगेन, एवरीबॉडी सेइंग सो वर्टिकल था। नाउ सी इट्स वेरी इजी। दिस इज द लाइन ऑफ इncision and your suture moves like this. Can you see here? Like this, and then it goes like this. This is the suture. Clear? So what will happen if you see the suture? Suture line will be perpendicular. So if the suture line is perpendicular to the line of incision, ये vertical matrix होगा. So जैसा image आया था उस हिसाब से आप सही मार्क करेंगे. ये image, this is simple interrupted. सिंपल इंटरप्टेड। ठीक है। कभी कभी आंखों का धोखा भी हो जाता है। देखिए आपके दिमाग में जो चल रहा होता है, सो कोई भी चीज आपके दिमाग में बैठी हुई है, हर तरफ वही दिखाई देती है। ठीक है। तो अगर आपके दिमाग में ऐसा बैठा हुआ है वर्टिकल मैट्रिक्स, हो सकता है आपको ऐसा वैसा दिखाई दे। आई एम नॉट श्योर। सो डिपेंड्स क्या क्वेश्चन आया था। मैंने तीनों एक्सप्लेन कर दिया, अकॉर्डिंगली यू हैव मार्क्ड, एंड आई प्रे कि सभी लोग का सही हो। ठीक है। Okay, so this is here according to this image. यहाँ correct answer is simple interrupted suture. Okay, guys, so it is simple interrupted suture. Next, identify the type of ulcer. First, tell me the location. ये कौन सा region है? ये medial malleolus है, right? So, guys, which region is this? You know, this is gaiters. So this is gaiters region. Gaiters. बताइए जरा, what is this ulcer? So typically, this is venous ulcer, which is having sloping edge. अगर शिन ऑफ टिबिया पे होता, टोस के टिप पे होता, तो आर्टीरियल अल्सर। व्हाट इज द स्पेशल फीचर ऑफ आर्टीरियल अल्सर? इट इज हैविंग पंच्ड आउट एजेस। इट इज पंच्ड आउट। वीनस अल्सर, इट इज हैविंग स्लोपिंग एज। स्लोपिंग एज। ठीक है। न्यूरोपैथिक अल्सर कहाँ होता है? दीज आर ट्रॉफिक अल्सर ओवर द बोनी प्रोमिनेंसेस, लाइक ओवर द सेक्रम, ओवर द हील। सो व्हाट इज द करेक्ट आंसर हियर गाइस? आई होप सबका सही होगा। Correct answer is venous ulcer. So it is venous ulcer. Clear, guys? Correct answer is B. After that, again, easy treatment. देखिए, this question was asked multiple times in exam. EDH, SDH, and subarachnoid hemorrhage. In this case, you can see here, guys, this is, you can see this hyperdense area in the basal cistern. इसका मतलब there is presence of blood in the basal cistern. What is the diagnosis? Subarachnoid hemorrhage. और अगर EDH होता, EDH में what kind of appearance is there? The appearance is something like this. There is this kind of appearance. What? It is biconvex. और अगर SDH होता, so in SDH this kind of appearance is there. So this is SDH, this is EDH, extradural or epidural, and here this is subarachnoid hemorrhage. So it is subarachnoid hemorrhage. Correct answer is option A. So diagnosis of a patient of a CT film who came to emergency after road traffic accident. Here, since you can see this hyperdense areas in the basal cistern region, this is subarachnoid hemorrhage. Okay, somebody was telling me that, sir, severe headache was also given in the question. In the question, severe headache was given. So there was severe headache. So severe headache was given in the question. Severe headache. Clear? So severe headache was given. Obviously, patient is going to describe that, sir, it was the worst headache of my life, or it's the worst headache of my life. ये है subarachnoid hemorrhage. Correct answer is option A. Okay, next. ये थोड़ा सा different question है. Yes. हल्का सा बताइए जरा, what is the correct answer? Let me see who is the genius over here. Okay. Ved Prakash wants to say, sir, दो question था. एक question was related to location and one was related to severe headache. अच्छा, वो क्लस्टर हेडेक था। हाँ, वो क्लस्टर हेडेक का ट्रीटमेंट पूछा था। ठीक है। नाउ सी दिस क्वेश्चन गाइस। 7 years old male baby 7 years old male baby brought to emergency 6 hours after burn, was having 22% involvement of 22% of body surface area, right? On examination, cool extremities, BP 92/50, pulse rate 56, blood pressure beats per minute, urine output since burn was 30 ml. 30 ml. What is the next step in the management? Clear? So guys, this patient is in the state of shock. And whenever, if you are going to treat this patient according to ABCDE, airway, breathing, circulation, disability and exposure. In circulation, हम लोग कितना बोलस देते हैं बताइए? How much bolus is given in children? How much? 20 ml per kg. is the 20 ml per kg. बच्चों में after burn, if patient is in the state of shock, what happens? The bolus is 20 ml, 10 to 20 ml per kg. तो bolus कितना देते हैं? We give 10 to 20 ml per kg. That's the bolus. Otherwise, you have to follow the Parkland. And according to Parkland, what? It is 4 into burned surface area into body weight in kg. Body weight in kg. Clear? And whatever the fluid is calculated, half of the fluid is given in first 8 hours and rest half is given in next 16 hours. Okay. Abhini, they mentioned that they applied Parkland formula. Next, what to do? Yes. तो शुरू में क्या देंगे आप? फ्लूइड कितना देंगे? इट शुड बी 4 into body surface area into body weight, burn surface area into body weight in kg. Half of the calculated fluid is given in first 8 hours, rest half in next 16 hours. मेंटेनेंस फ्लूइड में कितना बोलस दे सकते हैं हम लोग? बोलस कितना देते हैं? 10 to 20 ml. ओके सर, हार्टमैन सोल्यूशन वाज देयर? यस. तो रिंगर लैक्टेट है. हार्टमैन को दूसरा नाम क्या होता है रिंगर लैक्टेट का? हार्टमैन सोल्यूशन. So give bolus of 10 to 20 ml per kg of ringer lactate or Hartmann solution. Clear? Guys, so maintenance के लिए bolus कितना देते हैं बच्चों में? It is 10 to 20 ml per kg. This question was asked for the first time. ज्यादातर question trauma के फॉर्म में पूछता था. In trauma, how much bolus is given? The bolus is 20 ml per kg. और adults में सीधे हम कितना देते हैं? 1 liter. 1 liter of ringer lactate. Okay. Bunny wants to say that sir question में सब कुछ मेंशन था कि fluid was given by Parkland, child was not recovering, इसका मतलब patient is in the state of shock और उसमें bolus कितना देंगे? How much? It should be given 10 to 20 ml per kg. Okay, so question में था the fluid was given according to Parkland formula. Fluid was given according to Parkland formula. Patient was not improving. So this patient was not improving. Patient was not improving. Here, so patient was not improving. Now what should be given? Bolus कितना देंगे? 10 to 20 ml per kg. Yes. New filthy dog. New Parkland formula says 2 into body surface area. Filthy ये गलत है. Let me tell you. If you see the Bailey 28th edition, the new or advanced Parkland formula उसमें भी 4 ml per kg है. और करेक्शन कहाँ है? If in the question it is said ATLS modification, so if in the question ATLS modification दिया है, साथ में एडल्ट है या बच्चे की एज 14 ईयर्स से ज्यादा है, उसमें 2 ml है. लेस देन 14 ईयर्स और बॉडी वेट अप टू 30 kg, उसमें है 3 ml. और अगर इलेक्ट्रिकल 1 है तो उसमें है 4 ml. सो दैट्स नॉट न्यू पार्कलैंड. It is ATLS modification of Parkland. मैं फिर से बता रहा हूं, whenever any question is asked, what you apply this formula 4 ml per kg. जब तक क्वेश्चन में ना लिखा हो ATLS modification, और सबके लिए ATLS modification अलग अलग है. Adults and age 14 years 2 ml. Children less than 14, body weight up to 30 kg 3 ml. और इलेक्ट्रिकल 1 है तो 4 ml. Got it? So guys, here what is the correct answer? Correct answer is option A. Next, after road traffic accident, patient has severe maxillofacial trauma. एक famous question है, कई बार आ चुका है. SpO2 80% at room air. Patient cannot be intubated or ventilated. What should be your immediate step? Guys, tell me what's the correct answer. Waiting for your reply. Easiest question. Immediate step. Patient is having severe maxillofacial trauma. That's why patient cannot be intubated. Very good. Very good. Denchik, very good. फिल्थी डॉग, अभिनीत यादव, बहुत सारे लोग कंफ्यूज हैं 2 ऑप्शन में. देखिए, whenever patient is having maxillofacial trauma, what the emergency airway is cricothyroidotomy and definitive airway is tracheostomy. यहाँ the SpO2 is 80%. Immediately you go for what? Immediately go for needle cricothyroidotomy. So this is emergency airway. So that you are getting 10 to 12 minutes extra to prepare yourself. And what is the definitive airway? What is the definitive airway? So definitive airway, that's tracheostomy. Emergency airway is cricothyroidotomy. तो यहाँ immediate step पूछा है. Immediate was what? Cricothyroidotomy. Okay, somebody wants to say tracheostomy, sir, option में नहीं था. So what was there in the option? Yes, tracheostomy was not in the option. It was not in the option. Okay, not in the option. It was not there in the option. Nasal airway. इसकी जगह nasal या mouth airway था. Airway insertion. Airway insertion. Okay. So it was airway insertion. फिर तो कोई confusion ही नहीं. There is no confusion at all. So I hope everybody marked correct. अच्छा, nasal oxygen था. It was nasal oxygen. So I hope everybody marked the option correctly. Cricothyroidotomy. So guys, here the correct answer is cricothyroidotomy. इसके भी आने के chances बहुत ज़्यादा है नीट पीजी में, because this is famous question. Patient who is having maxillofacial trauma, emergency airway, cricothyroidotomy, definitive airway, tracheostomy. Clear? So tracheostomy was not there. So everybody marked the question correctly. Very good. Next question, guys. Easy. 30 years old male presents to emergency with history of penetrating chest trauma on examination, severe tracheal deviation. What is the immediate step of management? सिर्फ इतना ही था या कुछ और भी था एग्जाम में, लैंग्वेज में? You can make the diagnosis on these two features only. Yes, Dr. Nadeem, you're correct. It is very good, Jay. You are absolutely correct. मास्क एट जाट वांट्स टू आस्क कि सर क्वेश्चन रिपीट हो सकता है. देखिए, क्वेश्चन की तो मैं गारंटी नहीं लेता, बट 100% टॉपिक्स रिपीट होंगे. टॉपिक्स में टेंशन निमोथोरैक्स, मैक्सिलोफेशियल ट्रॉमा, गैस्ट्रोस्किसिस, ओम्फैलोसील, प्यूर जेगर सिंड्रोम, इनके रिपीट होने. फियोक्रोमोसाइटोमा, हाशिमोटोस थायराइडाइटिस, ग्रेव्स डिजीज, डिम्पलिंग, पुकरिंग, ये सब क्वेश्चन, ये एवरग्रीन टॉपिक से रिपीट होने के चांसेस है. क्वेश्चन नहीं, टॉपिक. ओके, सो गाइस, हियर कुछ था ऑप्शन में. Okay, two in second intercostal space, needle decompression in second intercostal space, chest stab injury or chest trauma, stab injury. Okay, so guys, here patient is having tension pneumothorax because there is severe tracheal deviation, right? So patient is having tension pneumothorax. What is the immediate management in tension pneumothorax? Immediate management, what you have to do? Needle decompression. अगर बच्चा होता, second intercostal space in midclavicular line, but this patient is an adult. Since adult patient is there, needle decompression in fifth intercostal space. Fifth intercostal space in anterior axillary line. Mid axillary line नहीं है, anterior axillary line. So fifth intercostal space in anterior axillary line. And what is the treatment of choice? You know, we have to insert the chest tube. ICD insertion. तो treatment of choice क्या है? Treatment of choice is ICD insertion. The insertion site is same. कहाँ insert करेंगे? Fifth intercostal space in anterior axillary line. ओके, सो अच्छा, सेकंड ही दिया था. अगर सेकंड ही दिया था तो आपके पास कोई ऑप्शन नहीं है. यू हैव टू गो फॉर नीडल डिकम्प्रेशन. बट आइडियली हम कहाँ इंसर्ट करते हैं? फिफ्थ इंटरकॉस्टल स्पेस. तो हो सकता है एग्जामिनर को आइडिया नहीं हो. क्लियर कि एडल्ट्स में कभी कभी ऐसा होता है, या कहीं से रिपीट क्वेश्चन एग्जामिनर ने उठाया जिसमें लैंग्वेज चेंज नहीं किया हो एग्जामिनर ने. फिफ्थ नहीं दिया था, सेकेंड इंटरकॉस्टल स्पेस दिया था. फिर भी अगर इनमें आपको चूज करना है तो देखिए, you are not going for chest x-ray. E-fast is not going to help immediately, right? Because आपको पता है, in this case, since there is severe tracheal deviation, what you have to do basically, there is tension pneumothorax. Immediate step is you have to go for needle decompression. Now see guys, इसमें दो तीन options है. देखिए, one is this. But suppose somebody is saying that sir question में ऐसा था कि stab injury था, stab injury के बाद नहीं नहीं. See, it depends. लैंग्वेज के बेसिस पे क्वेश्चन चेंज हो सकता है. ऑप्शन देखिए, वन, इफ पेशेंट इज हैविंग स्टैब इंजरी और पेनिट्रेटिंग चेस्ट ट्रॉमा और देर आर अदर फीचर्स सजेस्टिव ऑफ शॉक, राइट? सो इन दैट केस यू कैन गो फॉर ई फास्ट ऑल्सो, जिसमें आप मैसिव हीमोथोरैक्स सस्पेक्ट कर सकते हैं. मैसिव हीमोथोरैक्स. सो डिपेंड्स ऑन लैंग्वेज. एग्जैक्ट लैंग्वेज के बेसिस पे डिपेंड करेगा. इट डिपेंड्स ऑन द लैंग्वेज. क्लियर? सो इफ देर इज मैसिव हीमोथोरैक्स, कुछ ऐसी फाइंडिंग होगी, उस केस में आंसर हो जाएगा ई फास्ट। क्लियर गाइस? और अगर सिर्फ ऐसा क्वेश्चन का लैंग्वेज है, ओके, ट्रेकियल डेविएशन वाज नॉट देयर, अगर ट्रेकियल डेविएशन नहीं है, इफ देर इज नो ट्रेकियल डेविएशन, देन द आंसर वुड बी ई फास्ट। ठीक है? Now, guys, it depends. देखिए, whenever what suppose patient is having tension pneumothorax, another finding is on percussion, there will be hyperresonance. If there will be hemothorax, massive hemothorax, in that case, what will be happening? On percussion, it will be dull, right? So if the findings are suggestive of hemothorax, in that case, answer हो जाएगा आपका E fast. The answer would be E fast. और अगर pneumothorax, tension pneumothorax की finding होगी तो needle decompression होगा। ट्रेकियल डेविएशन था, अगर ट्रेकियल डेविएशन है, findings are suggestive of tension pneumothorax, then the answer would be needle decompression. ठीक है? Okay. Next question. Given below, what is the correct sequence of damage control surgery? How many stages are there in damage control surgery? There are 5 stages. 1, 2, 3, 4, 5. What is the first stage? First stage is patient selection. Patient selection के बाद हम क्या करते हैं? We take the patient to emergency, operating room, and control the hemorrhage and contamination. So second stage है control of hemorrhage and contamination. What is the third stage? We take the patient for ICU resuscitation for 48 hours. So it is ICU resuscitation. What is the fourth stage? Fourth stage is definitive surgery. So this is definitive surgery. Definitive surgery. And fifth stage is abdominal wall closure. So abdominal closure. So I'm repeating, there are 5 stages: patient selection, hemorrhage and contamination. We control, we take the patient to OT, open the abdomen, control hemorrhage and contamination, shift the patient to ICU for 48 hours, जिसमें हम क्या करेक्ट करते हैं? Hypothermia, coagulopathy, metabolic acidosis. When patient hypothermia, coagulopathy, metabolic acidosis is corrected, उसके बाद definitive surgery, then abdominal wall closure. फिफ्थ ऑप्शन भी था एब्डोमिनल क्लोजर। अगर फिफ्थ एब्डोमिनल क्लोजर था तो करेक्ट आंसर क्या होगा? 1, 2, 3, 4, 5। सो दिस इज इन द सीक्वेंस। पेशेंट सिलेक्शन, मैं ये बता दूं, ये भी क्वेश्चन रिपीट क्वेश्चन है, INICET में आ चुका है, नीट पीजी में आ चुका है। सो फर्स्ट पेशेंट सिलेक्शन, देन प्राइमरी एक्सप्लोरेशन, टेक द पेशेंट टू OT, control the hemorrhage and contamination. After that, ICU resuscitation. After that, secondary exploration. And after that, abdominal closure. Okay, Dr. Saif. So all these 5 were there. So correct answer is option A, 1, 2, 3, 4, 5. Clear, guys? और मैं आपको बता दूं, इसके भी नीट पीजी में आने के चांसेस ज्यादा है। डैमेज कंट्रोल सर्जरी वेरी इंपॉर्टेंट। नेक्स्ट, which of the following electrolyte abnormalities may occur following transfusion of packed RBCs? Packed RBCs में क्योंकि RBCs का डैमेज हो सकता है, so there will be hyperkalemia. There is hyperkalemia. These patients are having, tell me, yes, hypocalcemia because of chelating agent. So calcium will be low. There is hypomagnesemia. Clear, guys? So what is the correct answer? Hyperkalemia. There is hypocalcemia. तो यहाँ correct answer क्या होगा? Correct answer is option B. So everybody is correct. Option B. Option B. केतन wants to say कि सर इसमें मैंने क्या किया मुझे नहीं पता। देखिए, जो भी आप आंसर सही मारते हैं, ठीक है, उसका याद नहीं रहता। इजी क्वेश्चंस याद नहीं रहते क्योंकि वो रिफ्लेक्स रिस्पॉन्स होता है। यूजुअली आप लोग सही आंसर मार्क किए होंगे बिकॉज इट्स अ रिपीट क्वेश्चन। नेक्स्ट, SIADH, सो यू नो दैट इट इज मोस्ट कॉमनली एसोसिएटेड विद स्मॉल सेल कार्सिनोमा ऑफ लंग। और क्या क्या ऑप्शन थे? एनीबडी रिमेंबर्स? आर्यन, व्हाट वर द अदर ऑप्शंस ऑफ SIADH? syndrome of inappropriate ADH secretion. Anybody remembers the other options? अच्छा, हाइपोनेट्रीमिया, ठीक है, हाइपोनेट्रीमिया या हाइपरनेट्रीमिया था, तो आई होप दिस वाज कवर्ड इन मेडिसिन। हाइपोनेट्रीमिया या हाइपरनेट्रीमिया। गाइस, कार्सिनोमा लंग इज वेरी इंपॉर्टेंट, यू हैव टू रिमेंबर द पैरानियोप्लास्टिक मैनिफेस्टेशन, राइट? और SIADH मेडिसिन का बहुत इंपॉर्टेंट टॉपिक है ऑब्वियसली। So important question is there, SIADH, you have from the surgery side you have to remember carcinoma lung, types of carcinoma lung, and paraneoplastic manifestation. Okay, smoker था, okay, smoker था, and there was increased calcium, hypercalcemia था, इसका मतलब स्क्वामस सेल कार्सिनोमा. ठीक है, डिपेंड्स ऑन द आंसर, राइट. सो उसका आंसर SIADH था. ओके, ठीक है. नेक्स्ट, ये क्वेश्चन, chronic smoker who has worked in cement factory for 20 years develop mesothelioma. All of you know that mesothelioma में smoking की वजह से risk नहीं बढ़ता है. You know that smoking is not a risk factor for mesothelioma. Smoking is a risk factor for carcinoma lung. Asbestos exposure is a risk factor for mesothelioma as well as carcinoma lung. So what here? What is the problem here? Asbestos. Mesothelioma is typically associated with asbestos exposure. SP चौधरी wants to say, एक क्वेश्चन था जिसमें था नेजल ब्लॉकेड. नेजल ब्लॉकेड था, नोज ब्लॉक था, नेजल ब्लॉकेड पूछ रहे क्या था बताओ. स्मॉल स्क्वामस सेल कार्सिनोमा, बेसल सेल कार्सिनोमा, स्मॉल सेल एडिनोकार्सिनोमा. गाइस टेल मी, एनीबॉडी वांट्स टू टेल मी व्हाट इज द करेक्ट आंसर हियर. इसका तो आप लोगों ने बता दिया, इट इज बिकॉज ऑफ एस्बेस्टॉस. देखिए व्हाट हैपेंस इफ देयर इज नेजल ब्लॉकेड, इसका मतलब साइनसेस से आया है, और साइनसेस में अगर मैलिग्नेंसी है, सो व्हाट इज द मैलिग्नेंसी इन द साइनसेस. नाक के अगर अंदर है, इफ इट इज इनसाइड द नोज, इफ इट इज इनसाइड द नोज इट इज स्क्वामस सेल कार्सिनोमा. और नाक के बाहर है, इफ इट इज आउटसाइड हियर नियर इनर कैंथस और नोज, अगर ये बाहर है, स्किन में है, सो इट इज बेसल सेल कार्सिनोमा. आई एम रिपीटिंग, इफ इट इज इनसाइड अराइजिंग फ्रॉम साइनसेस, स्क्वामस सेल कार्सिनोमा. नोज के ऊपर है, इनर कैंथस के पास है, देन इट इज बेसल सेल कार्सिनोमा. बाहर था तो बेसल सेल कार्सिनोमा है. यस, बेसल सेल कार्सिनोमा. डिपेंड्स, बाहर था कि अंदर था, और एग्जैक्ट क्या फाइंडिंग थी. देखिए बेसल सेल कार्सिनोमा में द पेशेंट स्किन कलर विल बी फेयर, एग्जैक्ट लोकेशन नोज के आसपास होगी. इफ यू विल सी, दे विल बी सेंट्रल डिप्रेशन, दे विल बी पर्ली व्हाइट नोड्यूल्स इन द पेरिफेरी, और आप नोटिस करेंगे मैलिग्नेंसी के ऊपर देर इज डायलेटेड वेसल्स, जिसको बोलते हैं टेलेंजेक्टेजिया. ओके, टेलेंजेक्टेजिया. सो हियर इट इज एस्बेस्टोसिस. नेक्स्ट, human papilloma virus infection is most commonly associated with which type of cancer? Most commonly, tell me guys, you know the answer. Nasal fold था, अगर nasal fold है, basal cell carcinoma. See, somebody was telling me the question, telangiectasia है, lesion on the canthus, ये सब finding basal cell carcinoma की है. All these findings are suggestive of basal cell carcinoma. Okay. Now here guys, HPV infection, it is not related to lung cancer, not related to carcinoma stomach. It is mainly related to oropharyngeal cancer, carcinoma oral cavity, oropharynx, nasopharynx. Sorry, oropharynx. So oral cavity and oropharynx. Carcinoma esophagus का भी risk बढ़ाता है, but here most commonly it was asked, so most commonly it is oropharyngeal cancer. Oropharyngeal cancer. Okay. Next question. Which organism is most commonly responsible for gas gangrene? All of you know. Gas gangrene, guys, tell me. Easiest question. Gas gangrene. All of you are correct. Laryngeal was also in the option. Okay, laryngeal was also there is the option. So it is Clostridium perfringens. That is gas gangrene. Welchii tha. Clostridium welchii. Okay, oral cavity was there in the option. So oral cavity you can mark. Right? Guys, anybody remembers any other question? Any question related to bile duct, gallbladder, bile duct, pancreas, breast cancer, trauma, sutures, sutures वाला हो गया. कोई सर्जिकल इंस्ट्रूमेंट था क्या? ओके, somebody wants to say ये क्वेश्चन नहीं था, चलिए हटा देते इस पे. ये नहीं था. Anybody remembers any instrument was there? Surgical instrument? Uretroseal. Okay, uretroseal. Oral cavity, oropharynx में oropharynx is the better answer. Uretroseal पे क्या क्वेश्चन था guys? Can you tell me what was the question related to uretroseal? Uretroseal? कोलिडोकल सिस्ट था. माय गॉड, कोलिडोकल सिस्ट, कोलिडोकल सिस्ट था। व्हाट वाज द क्वेश्चन रिलेटेड टू कोलिडोकल सिस्ट? अच्छा, यूरेट्रोसिल की इमेज थी कौन सा? एडर हेड और कोबरा हेड अपीयरेंस, आईबीपी, एडर हेड और कोबरा हेड अपीयरेंस। So it was adder head or cobra head appearance. It was adder head or cobra head appearance. Adder head or cobra head appearance. Okay. Choledochal cyst management. Choledochal cyst management. Anybody remember कौन सा type था choledochal cyst का? What was the type of choledochal cyst? Choledochal cyst management. अच्छा, क्वेश्चन था wound infection with pus. There was wound infection. Wound infection के साथ there was pus. Most common cause. ठीक है. हिस्टोलिटिकम दिया था. ओके, क्लॉस्ट्रिडियम हिस्टोलिटिकम. ठीक है. गाइस, एनीबॉडी रिमेंबर्स कोलिडोकल सिस्ट का मैनेज कौन सा टाइप था? Okay, it's a repeat question then. There was one question, what? That in choledochal cyst, which of the following is done in the management? Aspiration, फिर दूसरा था हेपेटिकोजेजुनोस्टमी, हेपेटिकोजेजुनोस्टमी. एनोरेक्टल कैंसर का स्टेज, राहुल, वेरी गुड राहुल. एनोरेक्टल कैंसर का स्टेज, कैन यू रिमेंबर? एनोरेक्टल कैंसर स्टेज, एनोरेक्टल कैंसर स्टेज, कैंसर स्टेज. इसका मतलब अभी तक तो 37 क्वेश्चन हो गए. एनोरेक्टल कैंसर स्टेज, एनीबॉडी रिमेंबर्स दिस क्वेश्चन? ये बायलैटरल यूरेट्रोसील था जो एनएमसी वालों के पास इमेज है, सेम इमेज है आईबीपी की. एक न्यूरोजेनिक ब्लैडर पे था क्वेश्चन. ओके, देयर वाज वन क्वेश्चन रिलेटेड टू न्यूरोजेनिक ब्लैडर. एनीबॉडी रिमेंबर्स द क्वेश्चन रिलेटेड टू एनोरेक्टल कैंसर स्टेज? साइज ऑफ ट्यूमर का पता हो, लोकेशन पता हो, इन्वॉल्वमेंट म्यूकोजा, सब म्यूकोजा. ओके, वेरी गुड. महेंद्र बारफा, RTA patient, CT brain normal and died within 3 hours. RTA patient, RTA patient, CT is normal, died within 3 hours. Died within 3 hours. Within 3 hours. Died within, NCCT was normal, died within 3 hours. Yes, very good. Diffuse axonal injuries. Very good. Mahendra Barfa, you are correct. Diffuse axonal injuries. So this is diffuse axonal injuries क्योंकि here the CT is normal, diagnosis is made on MRI. Here the diagnosis is made on MRI and it leads to vegetative state. It is having poor prognosis. So additional question 1, choledochal cyst हो गया. 2, anorectal cancer stage 3, RTA patient 4. Any other question? Perineal tear. अच्छा, perineal tear will be taught in gynae. Bilateral uretrosil. Okay, guys. Any other question? Salivary gland related question. Neck swelling, lymph nodes of neck. Very good. Pancreatitis, BP low. See, guys, you are so intelligent. अभी धीरे धीरे करके आ रहा है. Pancreatitis and BP low, we give ringalactate. Acute pancreatitis with hypotension, we give ringalactate. Acute pancreatitis with hypotension, what we give? We give ringalactate. More than 5 centimeter size mucosal involvement. म्यूकोजल इन्वॉल्वमेंट, अगर सिर्फ म्यूकोजल इन्वॉल्वमेंट है तो स्टेज 1 होगा. ओनली म्यूकोजल इन्वॉल्वमेंट, बिकॉज कार्सिनोमा रेक्टम में साइज डजंट मैटर, एनल कैनाल में साइज मैटर्स. ओके, अक्यूट पैंक्रेटाइटिस में क्रॉनिक एल्कोहलिक, पेशेंट वाज क्रॉनिक एल्कोहलिक. सो पेशेंट वाज क्रॉनिक एल्कोहलिक, हाइपोटेंशन है, वी गिव फ्रेज सिंड्रोम. वेद प्रकाश, फ्रेज सिंड्रोम वाज देयर. There was another question. 6. Fraze syndrome. Fraze syndrome. This is very important topic. It is also known as gustatory sweating. Fraze syndrome. Clinical features were given. Clinical features were given. That is flushing and sweating. Okay. Flushing and sweating. There was flushing and sweating. ठीक है. Flush. Option was sweating while eating. Okay, Bunny, बताओ Bunny, जल्दी जल्दी, I'll be waiting for you. Shock case, next step. 7th question. Patient in the shock. Next step. First, guys, we give crystalloids. Crystalloids. After crystalloids, अगर ये blood loss की वजह से है, if the shock is because of blood loss, in that case, we have to go for blood transfusion. If it is because of burns, in that case, we go for colloids. Okay, Fraze syndrome में exact option में क्या था? Anybody can tell me? Triage. There was one question about triage also. Okay, very good. Question number 8. Triage. Triage. Triage में young girl leg was fractured. Fracture. Leg. It was simple fracture or compound fracture? Fat embolism question. My God. Fat embolism. Till now we discussed approximately 43 questions. Fat embolism. Obviously it is yellow. Compound fracture है तो yellow होगा. Simple fracture है तो green होगा. So fracture leg. If it is compound fracture, it is yellow. Compound fracture, then it's yellow. Fat embolism, limb lacerated, but she is normal. If अगर सिर्फ laceration है, only laceration is there, फिर green होगा. Compound fracture है, then it will be yellow. If laceration is there, only laceration, सिर्फ laceration है, if laceration is there, it's green. Laceration is green. Absolutely stable. Okay. अगर सिर्फ laceration था, bruise था, guys, it's green. Okay. Green. Fracture femur, X-ray was given. Okay. Fracture femur, X-ray. Manifestation दिया था. Respiratory distress, disorientation, bruises, or rashes in the axilla, chest, conjunctiva. Okay, multiple fracture, multiple bone fracture. Multiple bone fracture. Okay. Multiple bone fracture. Respiratory distress था. Respiratory distress. Patient was initially stable, then became disoriented within 24 to 48 hours. Okay. Okay, guys. Any other question? Graves disease presented with diarrhea. ये वाला question था क्या? Graves disease presented with diarrhea. Fat embolism. Second option में था pulmonary embolism. Distress on third day. Very good. After 48 hours. Distress, respiratory distress on third day. Third day. Okay, guys, you told me Graves disease with diarrhea. Question number 10. Graves, diarrhea. Graves disease with diarrhea. There was protruded eyeball. Thyroid से 4-5 क्वेश्चन थे. There was exophthalmos, exophthalmos, exophthalmos. Undiagnosed hypothyroidism, perioperative complication. Shrija, very good. It was like this, that intraoperative thyrotoxic crisis. Undiagnosed hyperthyroidism, perioperative complication. Question number 11. Undiagnosed. Undiagnosed hyperthyroidism. Undiagnosed hyperthyroidism with perioperative complication. Can anybody remember the options in perioperative complication? Perioperative complication. Arrhythmia, okay, arrhythmia, yes. Tachycardia. Okay. Arrhythmia, ठीक है. Related to medicine. Okay. Any other question, guys? Gallbladder, bile duct. Any sign, class sign, intussusception, volvulus, carcinoid tumor. Carcinoid tumor. Any question related to hernia, spleen, intestinal obstruction, ulcerative colitis? Ajinkya Biradar, what was the question on ulcerative colitis? Ulcerative colitis, anybody remembers? Question on ulcerative colitis? Umbilical hernia, image-based question. Okay. Umbilical hernia, image-based था कि gastroschisis था? Guys, apart from gastroschisis, umbilical hernia was also there. Image-based question. Paraumbilical hernia. Okay, it was paraumbilical hernia. Anybody remembers? Anybody remembers what was the option in paraumbilical hernia? Uveitis. Okay. Ulcerative colitis में what are the extra-intestinal manifestation like uveitis? Extra-intestinal manifestation like uveitis. Uveitis. Umbilical hernia, paraumbilical hernia. Gastroschisis हो गया. ठीक है. Intestinal obstruction was there or not? Stomach में और ulcer related carcinoma, stomach related any question? Plastic surgery में cyst related, keloid, hypertrophic scar. Okay, brain tumor, neurosurgery. ठीक है, guys. So I think we are done. And approximately we discussed 45 questions. Esophageal carcinoma. Saeed Mateen. He wants to say that, sir, esophageal carcinoma आया था. Anybody remembers esophageal carcinoma? एक तो बेसल सेल कार्सिनोमा हो गया. ओके, बेसल सेल कार्सिनोमा, यस, बेसल सेल कार्सिनोमा हो गया. कार्सिनोमा esophagus. Plummer Vinson syndrome. Guys, Plummer Vinson syndrome was there or not? Plummer Vinson syndrome was there? No? Okay. Okay, guys. So I hope you did well in the exam, and my best wishes are there with all of you. From the whole PrepLadder family, we want that you should clear this exam with flying colors, and we should meet again for the NEET PG preparation. Okay, guys? So best of luck. Take rest. Bye-bye.